Physicians of Reddit, what's the worst injury you've seen at a routine checkup? Not physician, but X-ray tech. Had a patient walk into the urgent care for hip X-rays. Her order said it was for hip pain, which is pretty routine. Turns out she had walked in on not one, but two fractured hips. ED doc, so hardly a routine visit, but a guy comes up to the fridge window with his arms over his head, palms of his hands pressed against his ears. I'm in tremendous pain, he says when asked what's wrong. X-rayed him and found he'd broken his neck. My brother once jumped on the front of my white car, grabbing the front pillars with his hands. I closed the door and caught his finger, which he pulled out quickly, as you do, but there was a tiny chip of paint that had come off the car and got lodged under the skin somehow. He must have spent a week or so chewing on it to try to get the paint out. But it just wasn't working, so he went to the doctor to see if he could help. After checking it out, the doctor tells him, the reason you can't get that out is because it's your bone. Apparently when I shut the door on his finger, I'd broken the tip of his pinky enough so he could see the bone through the skin, and he'd spent the next few days trying to pull his own finger bone out with his teeth. Welp. This was the one that made me put the phone down and just stare off into the distance. This was not a routine medical exam, but I was a triage nurse in the ER when a patient calmly walked up and reported a complaint of pain in my side. He failed to mention the blood in the handle of the butcher knife sticking out of the left lower quadrant of his abdomen. He was a homeless schizophrenic who had been stabbed and had calmly walked into the ER and waited his turn to be seen. I am just glad he came in at all. We also get a lot of people who come in for other things, a sore throat or a cough. And when doing a skin assessing we find huge pressure ulcers or gangrenous feet. I have twice had a patient's toe come off when I removed their sock. Neither time had they come to the ER for that issue. A patient who had a routine checkup at his ophthalmologist, eye doctor, who found a small spot in his retina, was referred to a university hospital. Tests showed it was metastases from a small malignant melanoma he had on his back. Our professor cancelled our lecture because he had to tell this otherwise healthy man that he probably only had a couple of months left to live. I was working at Target. Lived half a mile away, so I walked to work. It totally sucked, but I was out of shape and have cold-induced asthma, so I ignored it. At this time I was picking up shifts left and right, so sometimes I was closing the coffee shop. Sometimes coming in at 4 AM to unload the truck. I was basically a zombie from what I assume was lack of sleep. This goes on for a couple months. Until I had my annual physical. I was joking with my doctor that I was super exhausted from work. And I must be getting out of shape because that half-mile walk to work really sucks. Turns out I had severe pneumonia. One lung was totally full of liquid and the other had some liquid too. The doctor couldn't believe I was still up and about, let alone walking to work and whatnot. Junior doctor from Australia here. I had a young lady come in for a pap smear. She was chatty and relaxed. Not nervous at all. She lay on the bed and I got the speculum ready. I opened it up and instead of seeing her cervix I saw a kiwi fruit sized blob of bloody tissue just hanging out in her vaginal canal. It was one of my first pap smears I ever did. And I had a sudden bizarre thought that I had broken her vagina. I hadn't though. It was just a big uterine polyp that had emerged and was in her vagina hanging by a thread of tissue. She was mortified, although I tried to reassure her. This was in a small town, and later that day I went to the bakery to get some lunch and she was behind the counter. The most common surprise I see is patients in long-term marriages etc who come up positive for chlamydia. Edit. Wow, thanks for the replies. I first post. Comma from Australia. Dot. Comma kiwi fruit sized blob of bloody tissue. Yep. Checks out. Bloody kiwis. First year nursing student in LA, and I was at clinicals when a guy who I had to do a physical assessment on, all we could do since we don't know much, tells me he's been hearing strange cracklings and noises in his ear. I check his ear and it is filled with so much wax and whatnot. Call my RN advisor and she proceeds to clean out the guy's ear. What does she find? F-king fruit fly nest. Yay. The medical field can get pretty rad. Edit. Sorry for making so many of you cringe at the thought of that happening. I'm sure it's not as common as some people mentioned. Comma, and by nest I meant 3 or 4 of those damn things. It's always insects. It's never a puppy. Mum's a nurse and told me about the time a bodybuilder came in with a pulled muscle somewhere in his abdomen that was causing him severe pain. Long story short, the guy was riddled with cancer. It was everywhere. Apparently he was dead within 72 hours. Not a physician, but I was doing medical service in Guatemala and we had an older gentleman come into our clinic to have a checkup. And the entire time he sat there with us, he was resting his arm on what we thought was a bag or purse on top of his leg. At one point he goes to move, and we see a huge lump underneath his poncho, what we thought was his bag, and ask him about it. Turns out it was a tumor that had been growing for around 10 years on his leg. And he wasn't even going to tell us about it. I was putting a patient with mild breathing difficulty on a COPD research study. He remarked that he had been healthy as a horse all his life. The next day, his routine chest x-ray showed metastatic lung cancer. He was dead within 2 months. Guy shows up for a discharge physical, Marine. Noticed what looked like cellulitis on his leg. Turns out it was a brown recluse bite that he ignored. Had a fist-sized hole of dead tissue in his leg. We treated it with maggots for a few days. It healed over with a very nasty dent scar. Edit. Yes. Maggots are still a thing. We import them from Mexico. We dump them straight into the wound and put a clear cover over it, so we can see them. We check a few times a day to make sure there aren't too many dead ones in the wound. They will eat only the dead tissue and yes, the patient can feel them squirm. We also use leeches. They are good for the anticoagulant effect for things like finger reattachments. They keep the blood flowing and keep swelling down so the blood vessels can reattach and heal. We use cats in nursing homes to keep the residents in better spirits. Even the worst Alzheimer's patient seems to respond to cats. We also use electric eels to help keep babies awake so they... Okay. That's not true. But it is funny. Not a physician but did EMT work while deployed for local nationals seeking help. Had one guy get carried in from the nearby village and we're called out to the EC to see what we can do. For a toothache. He's barely responding when we arrive and smells worse than death. Still makes me gag thinking about it. Start doing the usual initial contact assessment and he's in bad shape. Vitals are all low. He's hardly there. And pus keeps oozing from his eyes and other orifices whenever you touch or apply any pressure to his face, which feels like an old soggy banana. Come to find out he's had an infection for like 10 years and it's spread throughout his skull, neck, and into his chest. A single tooth. Long story short, he died not too long after that while we were waiting for transport. The dude went down cause he didn't take care of an infection. Never seen anything like that and doubt I will anything. Guy comes in for an eye exam. I note one eye seems a bit redder than the other. He tells me it's been like that since a branch snapped back and hit him in the face 3 months earlier. I look under his upper lid and there is a piece of wood the size of a tic tac embedded in the underside of the eyelid. Cannot believe it did not bother him more. One time my eye was kind of bugging me for a few days. I was rubbing it and looking at it in the mirror when I noticed a tiny little hair in the corner of my eye. I got it with a tweezer and slowly pulled out an 8-inch long hair from my eye socket. It went way back too. Felt totally bizarre coming out. It was also coated in eye goo. I have no idea how it got in there. Eyes are weird. Not a physician but a clueless patient. Went to go see my doctor for a checkup. Had chest pains waking up that morning. Started to feel like someone is sitting on my chest. Walked 15 minutes to the physician's place. And apparently after he checked my breathing he told me I had to go to the ER to get my lungs x-rayed. Spent a week in the hospital for having a 40% collapsed lung. Doctors called it a spontaneous lung collapse. Really not the kind of spontaneity I'm looking for in my life. Edit. A lot of people are asking if I'm tall and skinny. I was pretty fit at the time. Was running half marathons, and I would say average height, 5 feet 11. Also, never smoked anything ever. I went to an urgent care and someone must have miscommunicated to the doc because I rolled into a room in a wheelchair. And doc asked me about my cold. I said I don't have a cold. But I'm not sure what I did to my leg and rolled up my pants. My kneecap was on the side of my leg. They seemed rather surprised. They told me to go to the ER immediately. We just got a guy in with Fernie's gangrene from a very alarmed family practice doc. His nuts are in his thigh now. Capital D. Edit. Gangrenous balls and taint. If you were curious. Google Images has some exciting results. Heard this story from my aunt who works in a eye center. One day this woman came in with her friends. All drunk and high as FCKHT. She was holding her eyeball. Somehow she managed to get hit in the face by a pair of heels and it pulled out her eyeball in the process. The kicker is after surgery and all that. She still seemed cheerful and even asked my aunt when her eyesight would recover. Apparently she was under the impression that her eyeball could be reattached. I think the kicker is whoever was wearing those heels. Pre-registration optometrist here. Had a lady present recently for an eye test following months of very painful headaches. She had scans done at the hospital recently and everything had come back normal. The only reason she was in for a test was that her eyes were the last thing she could think were causing it and she was due for a checkup anyway. Cue me looking into her eyes and finding her optic nerves in both eyes, which usually lie flat against the back of the eye, swollen and pressing forward, with massive hemorrhages in the nerve fiber layer of her retina. Naturally the hospital was phoned and she was seen within the hour. The swelling had been caused by raised pressure in her head. A potentially life-threatening condition. As far as I am aware the neurologists are now on top of it and she is recovering well. Scary stuff as I had only been qualified 2 months at the time. Edit. Put the word pressure in twice in a row. Y'all mothfcas make me want to get a full body exam. I've read some shitty. Nurse. But. Some guy came in with Laferte eye and eye fractures. Said he fell and hit his head on a tractor step about a week ago. Was just coming for medication refills when we asked about the mild facial trauma. Tiny laceration. Unremarkable bruising. Denied all pain medication. And very minimally accepted it after surgery only because we practically talked him into it. Maxillofacial surgeon was excited about it. She came down personally to get him and take him up to surgery. Edit. TL. DR his face was floating and not attached to the rest of his skull. Not a routine checkup. A woman 36 weeks pregnant comes into the doc in the box complaining of nausea, vomiting and pain between her shoulders. We ultrasound her abdomen. Everything was fine with the kid. Somebody had the bright idea as long as the ultrasound was out to ultrasound between her shoulders. To our astonishment she had a huge dissecting aortic aneurysm. She had to be survival flighted to a level III place and have a crash C-section and her aneurysm fixed. The aneurysm was at least 5 centimeters across. She and the baby both made it. Another not a doctor but. I arrested a guy after a brief foot pursuit for attempted burglary and several other nuisance charges. He was covered in blood from multiple small scratches when I first found him and had a decent sized gash above his eye that looked like it just needed a couple stitches. Took him to the ER to get stitched up and they did a CT scan. Doctor is stitching the guy up and about to release him when the CT comes back. Fractured orbital resulting in an air pocket forming in the guy's brain cavity. Turns out the guy dove headfirst off a rooftop earlier in the night and hit a fence on his way down. Meth makes things exciting. Meth makes things exciting. I think I like my boring life just fine. Not a physician. But my doctor might qualify. Got a fever for a few days. Had no other symptoms. I know that a fever without other symptoms can be really bad. So I go to the doctor. He says it's probably the flu and sends me home. Fever gets a little worse. I call him and tell him it's up to 102. And he tells me to go to the hospital. I get there. They give me drugs to reduce the fever. And do some blood work while keeping me in quarantine. Got my own room. Which is nice, because they didn't know what I had. Blood work comes back. And I'm septic. They said that it came from too much oral bacteria getting into my bloodstream. And that they usually see it with druggies that lick their arm before sticking a needle in, thinking somehow that it's sanitary. I traced it back to a mechanical toothbrush I got and how it made my gums bleed like crazy when I first started using it. So, yeah. Go easy on your teeth if you have sensitive gums. The bacteria in your own mouth can kill you if they bleed too much. Not me, but a friend of mine worked in the ICU and he once told me about a girl who came in that was on a jet ski and her bikini bottoms got caught on something and ripped her entire bottom open. Vagina to butthole completely ripped open. He said that stitching her up was incredibly awkward because she was a little drugged and super flirty. A guy comes into work with half of his face just sort of sagging. They were working 6 days a week, 10 hours days. At this point. So he just thought he was tired. He went to the doc. Turns out he had a massive stroke and was dead within the week. Healthcare professional in an ER. Not a physician. Asterisk. Routine. Older woman came in for bruising. She claimed that 2 weeks prior someone had bumped into her on public transit. And now the bruise on her chest wouldn't go away. Confused after having asked her height and weight, 90 lbs. I asked if she had lost any weight recently. Apparently she has lost about 40 pounds in the last 2 months. The bruise? Malignant F-king melanoma. Oh yeah. With mets, edit 2. Metastasis, everywhere. She was given a prognosis of 3 weeks to live. If I recall correctly. She passed in 2 other injuries that rank high on the worst list. Every pediatric code ever. GSWs, edit. Gunshot wounds to the face who are still conscious. Patients who die with readily apparent defensive wounds. Any injury that results in decorticate or decerebrate posturing. Suicides who use razor blades to etch suicide notes into their own skin. And ripping both of one's eyeballs out of their sockets with one's own hands. My dad is a mechanic. He was working on an engine when one of the parts fell off and landed on his hand. He was focused on the engine not falling off the chain when he looked down, noticed a pool of blood. Cleaned it off. Put super glue on it, went to his manager and said, "Yeah, I think I need to go to urgent care." Doctors told him he cut almost 90% of his tendon. Guy came in with an open sack. Mate's dad was a doctor in the Northern Territory. Horse. Working at a few Aboriginal missions. A lady came to him asking for Panadol because she had a headache. She hadn't noticed that when she fell over a few days prior. She had scalped herself. Maggoty head, skin flap and all. As a radiologist we see things that have been swallowed by kids all the time. I've seen a fish hook. Marbles. Open padlock. 5 cm steel nail. Batteries of all shapes and sizes. Open safety pin and countless coins to list a few. So long as they get past the stomach they usually pass through pretty well, except the fish hook. Common, but the ones which have caused the most damage are buckyball style magnets which can attract to each other through the bowel wall causing perforation and leakage, or button batteries which rapidly discharge and burn through tissues. There have been deaths from these seemingly harmless little things. My father is a radiologist and told us a story one day. Patient walks in his clinic complaining about a headache after a transatlantic flight. Since there are no obvious causes, a CT is performed. Turns out he has a broken neck that just did not sever his spinal cord yet. He got immediately fixated and apparently survived without major complications. Not a doctor, but a physical therapy tech. We had a patient come in for shoulder pain. After about a week we notice his shoulder blade sliding around a whole bunch while he is doing exercises. Like moving out and up and all kinds of ways your shoulder blade shouldn't move. Anyway, the PT asks him if he has ever had any injury and he tells her he was kicked off a horse and never went to the doctor 50 years ago. The good news is we, kind of, Got it back to normal and his shoulder doesn't hurt anymore.